I know that there's a lot of people out there who are very skeptical on even trying, probably because you may have had a negative experience in the past. What's up everyone, and welcome to Gwen Skin, the channel that's powered by ingredients and skincare and where we get to the naked truth of what those ingredients do. Today we are talking about the very unfortunate skin condition of acne vulgaris. Before we fully get into this, there are a couple things I do want to disclose with you guys. My name is Guinevere. I am a licensed esthetician in California. If you don't know what a licensed esthetician is, that means that I am a licensed skincare professional. And no, I am not naked, but at the same time, I personally cannot lie to you when I am naked, so I find it fitting. Today we are getting to the naked truth of a very unfortunate skin condition known as acne vulgaris. If you are somebody out there who has a little bit of acne that just bothers you every now and again, congratulations! You have won in the skin department. You have very little acne that is kind of just irritating you, but it's not cystic. However, if you are somebody out there who has very cystic acne, this video is for you. We are going to be getting into the contributing factors of acne vulgaris, what it looks like when it's developed in certain grades, and what ingredients work best when trying to treat it topically. So let's get into it. The main cause of acne vulgaris is going to be genetics. Genetics do play the highest factor in what kind of acne you will develop, as well as what kind of skin type you will have. So go ahead and blame your parents for that one there. Other causes can be hormonal fluctuations, environmental surroundings such as workplaces that have a lot of heat, oil, and debris that can stick to the skin, and a very poor diet. Now that last part mainly depends on your body and how it reacts to different foods such as dairy, extremely greasy foods, and artificial sugar intake. And beyond popular belief, acne vulgaris is not limited to just the face area. You are able to develop acne on your back as well as your shoulders when you are somebody who has developed acne vulgaris. Here's what you don't know about acne. Acne has two separate categories. They are acne simplex and acne vulgaris. Now in total, there is a total of 4 different grades of acne. Grades 1 and 2 fall into the acne simplex category, which are going to be more on the minimal side. So you're going to have a little bit of pimples popping out every now and again, inflammation here and there, but for the most part, your acne will subside. However, for those who have more acne vulgaris, which is grades 3 and 4, this acne category is going to have pustules, pimples, insane lesions, and even cystic acne developing. For the most part, you can help with treating your acne vulgaris with topical products. However, you will have to go see a dermatologist in order to be prescribed medication that will help from the inside out. When it comes to treating acne vulgaris, acne grade 3 tends to be a little bit easier as far as treating it with topical ingredients. You can use these same exact ingredients for acne grade 4, however you may need a little bit of help with treating your acne grade 4, and we will be getting into that. So here's acne grade 3. Acne grade 3 is a type of acne vulgaris that is characterized as having papules, pustules, lesions, comedones, and inflammation. My professional recommendation when treating any grade of acne, but especially acne vulgaris, is going to be gentle exfoliation. Gentle exfoliation is absolutely key. When you're using very rough scrubs or over drying ingredients on your skin when treating your acne vulgaris, you're actually overexposing your skin and over exfoliating your skin. To clear out bacteria and control oil in the skin, these are the ingredients that I professionally recommend that you look for in your skincare. Salicylic acid is a beta hydroxy acid and antibacterial. This ingredient clears out bacteria by breaking down the cells on the inner lining of the pores. Now, this ingredient can be a little bit more on the drying side and can cause overexfoliation. So using any product that has this ingredient in it should be used 1 to 3 times per week at best. Benzoyl peroxide clears out bacteria and prevents certain bacteria from forming pimples by breaking down the proteins and lipids in the skin sebum to reduce excessive oil production. Now, this ingredient can cause overexposure to the skin, so using this ingredient daily would definitely not help you. In fact, using this ingredient 1 to 3 times per week, you will definitely see a better result with that than on a daily basis. Kojic acid is an antibacterial that also helps with reducing the production of dark spots. Lactic acid is an alpha hydroxy acid that clears out bacteria through gentle exfoliation and keeps the skin hydrated. This ingredient is personally one of my absolute faves since discovering it, and I use it on a daily basis in my cleanser. Now, you may be thinking to yourself, why do I want to hydrate my skin while I'm clearing out bacteria? Isn't that what my oil does? So yes, your oil technically is hydrating your skin and keeping it hydrated. However, if you're using ingredients that are really drying for your skin and causing excessive dryness, then your skin is overcompensating by producing more oil because of that lack of hydration that your skin has. That excessive oil production is going to get stuck inside the pores, create bacteria, which in turn is going to cause pimples. And we don't want none of that. That's exactly what we're trying to get rid of. Aloe vera is an ingredient that I feel like we hear so much about that it's honestly in one ear, out the other. Yes, I know I should be using an aloe vera, yada, 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 but what it actually does for the skin is very important to know. So aloe vera is an antibacterial that has amazing smoothing and soothing abilities to it. So this becomes essential when not only clearing out bacteria, but also treating inflammation that acne can cause as well. Now, if you're somebody who has been suffering with acne vulgaris, then you probably know how easy it is for your skin to develop dark spots as well. A lot of people out there think that acne is the most common way to develop dark spots, which is actually not true. The most common way that people develop dark spots is actually through inflammation of the skin. Inflammation is something that can also just come hand in hand with your acne. So when treating your acne vulgaris, it's actually very important that you're also treating the inflammation and soothing the stress that your skin has gone through with having acne. Resveratrol is an anti-inflammatory that has been shown to reduce acne as well as hyperpigmentation. Niacinamide is a form of vitamin B3 and anti-inflammatory. With prolonged use of niacinamide, it has been shown to reduce breakouts because it increases necessary fatty acids and ceramides that the skin needs to keep itself hydrated. Grade 4 of acne vulgaris is characterized as having papules, pustules, comedones, lesions, and cysts. And all of these can be very painful for you. When treating grade 4 of acne vulgaris, all of the ingredients that I had just listed off can also help for you too. However, there is one ingredient in particular that I do want to inform you guys of, and that is retinol, also known as vitamin A. Technically, yes, everybody should be using a retinol or vitamin A in the evening 1 to 3 times per week. However, this ingredient becomes especially effective for those who have developed grade 4 of acne vulgaris because it helps to keep the skin in a constant state of cell turnover and it helps the skin retain moisture. Ultimately, as far as other ingredient recommendations go, it is very challenging for me to give you proper advice at this point because what can happen with grade 4 acne vulgaris is the follicular wall becomes so impacted by the amount of bacteria that has invaded that pore that it can unfortunately damage and start to infect the dermal layers of the skin. As a licensed esthetician, my expertise mainly resides in the epidermis. So if you are somebody who has developed grade 4 cystic acne vulgaris, please go see a dermatologist so that they can better prescribe medications that will help with treating your acne vulgaris from the inside out. Yes, you can and you should be looking for these ingredients that I had just listed before you go see a dermatologist and after you've been prescribed a medication that will help with treating your acne vulgaris. I just hope that with you watching this video, you are better informed of what will actually be treating your acne versus what's doing absolutely nothing for your skin. But unfortunately, at this point, when it comes to treating grade 4 of acne vulgaris, my professional recommendation is go see a dermatologist. Now, all of this advice and knowledge is 100% absolutely useless to you if you're not protecting your skin with a broad spectrum SPF of 30 or higher. And I know that there's a lot of people out there who are very skeptical on even trying a new sunscreen, probably because you may have had a negative experience in the past. However, you have to protect your skin. You absolutely have to. My professional recommendation for a sunscreen for those who are going through acne vulgaris is a mineral/physical sunscreen. The reason why is because this sunscreen is naturally broad spectrum and it does not penetrate the pores. So if you are somebody who has used a chemical sunscreen in the past and you've developed inflammation or even developed more acne and you felt that it was because of the chemical sunscreen, a mineral sunscreen will be much less irritable for your skin. Do stay connected with me through Instagram at GwenSkin. And if you watch my stories, I am constantly talking about different skin conditions and how to treat them with different ingredients and what those ingredients do. You can also take my skin quizzes to make sure that you're actually learning something so that when you're shopping for your next skincare product, you know exactly what you're looking at and looking for, rather than, I don't think I know what I'm looking for, but I think this is it. Do check my description box, as I will be leaving product recommendations that do have these ingredients in them so that you are better equipped at home to treat your acne vulgaris. Don't forget to like and subscribe so that we can keep learning about our skin together and get to the naked truth of what all these ingredients do. Thank you so much for watching. I hope that you guys took some very valuable information to heart with you. And until next time, I will see you in the fab lane. Get your car! Acne grade 3 is a type of acne... Blah, blah. Leaving your skin of the... Nope. 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 Bacterial.